Black Women and the Development of Gynecology by Kieran, Sanjana, Emma, and Madison.
Dr. James Marion Sims was born on January 25, 1813, in Lancaster County, South Carolina. His father used to own a shop. However, he became a sheriff in 1825, and this is when he sent Dr. Sims to the Franklin Academy. He studied at the Franklin Academy till 1832, and he then attended the University of South Carolina and went to the Medical College of Charleston. However, during his time at the Medical College of Charleston, he transferred to the Jefferson Medical College and graduated in 1835. His professors described him as an ambitious student. However, after graduating in 1835, Dr. Sims felt that he could never make much money off of medicine because it was a job that didn't have that much demand at the time. So he started having his own practice and seeing more patients. And unfortunately, his first two patients passed away. And he felt very discouraged and called his wife, Teresa Jones, and told her that they were just going to give up and move to Macon County, Alabama, where he would soon become a plantation physician from 1837 to 1840. Towards the end of the 1840s, he started to gain more fame, had the largest practice, and he was greatly popular among all the plantations, so he moved to Montgomery, Alabama, where he started to treat Black female patients, specifically Lucy, Anarcha, and Betsy. It was then where he started to also have the highly unethical surgeries and painful experiments. Around 1877, Dr. Sims suffered severe angina attacks, and he also had his second one in 1880. Because of how weak he felt during these angina attacks, he developed typhoid fever, and his immune system has completely deteriorated. So, in Manhattan, New York City, Dr. Sims suffered a severe heart attack and passed away on November 13, 1883. Because of his work in the field of gynecology, he was named the father of gynecology.
Dr. Sims is known as the father of modern gynecology. In recent years, his reputation has been somewhat tarnished because of his use of Black slave women in his medical experimentation. He's been accused of things such as torturing and experimenting on the Black slaves. This accusation is primarily derived from not using anesthesia on his slave patients. Sims became known as a skillful general surgeon and built a private 8-bed hospital in the rear of his home. Like many of his colleagues, he was soon making a very good living as a physician to slaves on local plantations and showed no interest in the yet-to-be-named specialty of gynecology. Sims has been quoted as saying at the time, "If there was anything I hated, it was investigating the organs of the female pelvis." He, as well as most men, did not especially want to treat women, let alone Black women. This statement was very interesting considering he would become the father of modern gynecology. His rise to fame began with his development of the first successful operation for the cure of vesicovaginal fistula, a catastrophic complication of childbirth in which a hole develops between a woman's bladder and her vagina and leads to constant and uncontrollable urinary incontinence. He also created the vaginal speculum. Its discovery was accidental and made out of necessity. Sims was called to treat a female patient who was not a slave, and she was thrown off a pony. He placed the patient with her knees touching her chest, which is today known as the Sims position, and created a tool from a pewter spoon to expand the walls of the vagina because he needed to see inside of it. Because Sims then had access and visualization, he was able to successfully relocate her displaced uterus to its proper position and thus causing a change in air pressure. The patient's relief was immediate. He then invented the vaginal speculum, a tool now used for dilation and examination, when he soon realized this would help him in the future to see into women, which is still used to this day. The subjects of Sims' discoveries were enslaved Black women. It was reported that Sims acquired, presumably that they were given to him because of their disability, 11 female slaves, all suffering with vesicovaginal fistula, by promising their masters to lodge, board, and treat them well. Over the next 3 years, Sims repeatedly operated on these women. However, this work was all in vain. Reports of the 3 original slave women named Lucy, Anarcha, and Betsy having all undergone multiple surgeries, some as many as even 30 surgeries, has been a major source of criticism of Sims. Defense of Sims' multiple surgeries has centered on understanding the desperation of the patients suffering from this condition. Women with this condition have a miserable existence, often being ostracized by society and their families, and occasionally are relegated to a hermit's existence. Indeed, they often begged for additional surgery and another attempt at a cure, but thinking Sims would find a cure, they really had no decision to try and get rid of the miserable pain they were in. Critics of Sims have insisted that these slave women were nothing more than human guinea pigs who had no choice in deciding if they were to undergo additional procedures. In my own opinion, I do believe that these women were victims of Dr. Sims. The women Dr. Sims tested these procedures on were enslaved black women with no choice whether to be tested or not. The first assertion is that it was unethical by any standard to perform experimental surgical operations on slaves because slaves, by definition, could not have been given voluntary informed consent for surgery. The only people that could consent this surgery were their masters. Underlying this assertion is the hidden presumption that enslaved women with fistulas did not want surgical care for their condition, and that they were therefore coerced into having unwanted surgery. Dr. Sims, as well as many others, took advantage of this chance to earn more money and began to treat slaves, even though they did not want to. While Sims did do the right thing in actually giving care to these women, he could have gone at it in better ways. For example, he refused to give African American anesthesia because they apparently had higher pain tolerance and they did not need it. But when treating his white women patients, he gave them anesthesia. In my opinion, this is him being racist because of the fact he did not only give it to all females, it was only the black ones. I do not understand how he could have thought they were not in pain as they laid there while screaming while other doctors had to strap and hold them down. In my opinion, these women were indeed victims.
When judging Dr. Sims, it's important to take into account that medicine has greatly evolved over time, and that modern medicine has many more safer surgeries and ethical regulations put in place. So if you are judging Dr. Sims from a modern medicine standpoint, obviously he violated many rules. For example, the Hippocratic Oath, which all doctors must take, clearly states a do not harm policy, and ironically, Dr. Sims performed painful surgeries, especially on black women, and he basically diminished their pain by stating that black people are not on the same level as white people, and that they cannot feel pain and that they're inhumane. He was also one of the few who believed that black people have less brain capacity than the white people and that they are less intelligent. So that's why their pain is not legitimate. On the other side, we have the argument of anachronism, which basically justifies that whatever Dr. Sims did was okay, because at one point in history, it was okay to have experiments done on black women and experiments done on the slaves. It was okay that Dr. Sims did not use anesthesia on black women because it was still an iffy topic, it wasn't widely available, it was still being tested, so it was okay that he didn't use it on the black patients. He also believed that it was okay to have a black female patient to be completely nude in her most vulnerable stage while he was performing a surgery in front of a ton of male colleagues. He also believed that it was okay for his black female patients to not consent to their surgeries because he believed that them showing pain was enough for having consent. So, in my personal opinion, I believe that Dr. Sims should be stripped from his title of the father of gynecology. And I believe this because a doctor should treat everyone equally and work to reduce their pain and suffering and not increase it. So, actually, when Lucy's surgery was being performed, it took her almost 2 to 3 months to recover because she suffered an infection that she got from the surgery, and she also got blood poisoning. So not only did she endure pain during the surgery, she also had to endure pain after the surgery. Currently, there are many activists who are trying to replace Dr. Stim's statue with the statues of the three Black women who shaped the future of medicine, who were Lucy and Erica and Betsy. And this is because without these three women, we would not be where we are today in the field of gynecology.
There has been a debate on whether or not removing the statue of Dr. Sims was a good thing or a bad thing. Dr. Sims made many medical advancements that improved women's quality of life. Despite the good he did make many bad decisions. He did not ask for consent to perform the experimental procedure, and he did it without anesthesia. This is very unethical and very harmful to the woman he chose to do this procedure on. There are some pros to keeping the statue. It reminds people of the procedure that he is known for. It shows people who have this complication that there is a surgery out there to help fix it. This also shows how big an accomplishment this was, because in order for him to have a statue, he would have had to make a pretty big medical discovery that changed many lives. However, there are some negatives to keeping his statue up. This reminds people of the lines that he crossed to achieve his goal. People might think that it is okay to do things the way he did. His statue brings recognition to him. This can make society upset because they could take the way he acted to heart due to the race and gender in which he chose to do this surgery on. He performed this procedure on enslaved Black women, which reminds people of a time in our country that was not good. This topic tends to hit close to home, and most people don't want to be reminded of it every time they see his face on a statue. In my opinion, I think it was a good decision to remove the statue. I feel that it is important to make people feel welcome, and this statue could do just the opposite for women, and more specifically Black women. There are other ways to show his accomplishments instead of putting a statue up for everyone to see. It's important that when we reflect on the methods Dr. Sims used to gain a better understanding of gynecology and the female anatomy, that we not only look at how unethical his methods were, but also how it helped to develop better medical practices in the fields of research and discovery, and the positives that came out of his research. Even though his process was questionable, I believe everything he did was out of curiosity and a drive to discover how to successfully perform the surgery to fix vesicovaginal fistulas. When comparing his kind of research to some of the research in Nazi Germany, his was considered therapeutic, which meant that he was taking a patient who was already sick and suffering and who was considered a social outcast and trying to improve their quality of life. And even though their condition wasn't fatal, it made the women feel isolated and like they had nothing left to contribute to society, and they were desperate to find a solution. On the other hand, the Nazis would do non-therapeutic experiments, like seeing if patients, if you even want to call them patients, more like subjects, could live through hypothermia to find out whether or not their pilots could survive in the water, knowing full well that the test subjects would die. And they would also do experiments like giving the subjects malaria to test drugs, even though they didn't know if the drug would even work. Now we have the Institutional Review Board, which reviews and must approve every research proposal before testing can begin. We also have the Belmont Report, which created requirements for getting informed consent and informing the patient on the risks and benefits of participating in a clinical trial. The Belmont Report also has guidelines for respect of patient privacy and safety, as well as respect for justice. Both the Institutional Review Board and the Belmont Report enforce the principles of bioethics, which are honesty, fairness, self-awareness, integrity, generosity, compassion, courage, and tolerance. While we have made tremendous progress in terms of bioethics, there are still many issues that we face in regards to uneven distribution of races in clinical trials. For example, in some cancer trials, 82% of the patients were white, and since most of the time the drugs were effective, minorities had a smaller chance of being able to receive these benefits. These reinforce the mistrust that minorities have of medical professionals and just goes to show that we still have a long way to go in diversity inclusion in medicine. I don't think Dr. Sims had malicious intent at all, and I don't think his choice of test patient was racially motivated. I think he was just using the resources and knowledge that he was given at the time that he was living in. And in the end, he did create a successful surgery for curing vesicovaginal fistulas, he invented the speculum, he invented the Sims position, and most importantly, he opened the doorway into exploring gynecology and the female anatomy. This is a pretty big deal because gynecology is now its own field of medicine and affects all women.